Hello, everyone. I am Yolanda Harper, Harper Therapy. I want to introduce you to Ben Germain.
Hello, everybody.
Ben is our newest addition to the Harper Therapy team and is joining us for his ninja neurofeedback skills.
Yep,
So,
that's right.
Yeah, awesome. So tell us a little bit about neurofeedback and what got you interested in it.
So neurofeedback is basically brain training for your brain. What we'll be doing is we'll be looking at your brain and see which areas are not exactly what we want it to be. Something that may be causing you some kind of symptoms in your normal day life. And we'll be looking at those issues and trying to train your brain to not do them anymore. So we'll train your brain to try to work in a more better, efficient way to help you with just your everyday functioning and day-to-day life.
Yeah. So neurofeedback is a form of biofeedback, which uses the body's own response mechanism. So in biofeedback, we look at heart rate, we look at blood pressure. With neurofeedback, we use the neurological components. And one of the reasons that I am passionate about including neurofeedback services at Harper Therapy is that it's a really effective, holistic approach to treating things like anxiety, depression, trauma, head injuries. So I was first introduced to neurofeedback in the retreat format, the veteran retreat, combat warrior retreat formats that I am able to participate in, and was really hooked from the very beginning and saw in that short amount of time how effective that neurofeedback can be. So what happens is you have something like anxiety, depression, where the brain is over-responding or under-responding, right?
As well as the connections between the areas. So one of the most important things about your brain is how it communicates within itself, the different areas of the brain. So we're looking at how the brain is communicating with itself, as well as areas that may be underactivated or overactivated.
So it's helping your brain learn more effective ways of talking to itself. And the way that we do that is by starting with what is called a QEEG or a brain map, right? One of the reasons I'm wearing this lovely hat is that's how we get the brain map.
Correct.
So you'll come in, we'll get this, you'll get to have this lovely cap on, and then we'll have real-time recordings of your brain's interaction and communication with itself.
Right, so it'll be a functional brain map. So it'll be how your brain is actually functioning. So we're not looking at maybe a physical, we're not seeing how physically it looks, we're seeing how functionally it looks. So we're seeing which areas are activating properly, which areas aren't activating properly.
And this is an example of what one of these brain maps looks like.
This is called a topographical map. It shows different areas of activation, overactivation. The red is actually overstimulated, and the blue is relatively understimulated. So what we want to do is we want to smooth that over a little bit to have more areas where it's not as drastically red or dark blue. We want to have that more in that middle area.
So we want to say to the red parts of the brain, hey, slow it down a little bit. And we want to say to the blue parts of the brain, speed it up.
Exactly.
Right? So we start with the brain map, which gives us an indication for treatment. And then we do the neurofeedback itself.
Correct. So based off of whatever symptoms bring you here in the first place and whatever we find in the brain map, I will actually make you a custom protocol developed specifically for your reasons, for whatever brought you here. So the symptoms themselves, and based on the brain mappings that I find, the results of the actual neurological issues that you may be having, I will personally make you a personal protocol that is just for you, for the brain mapping, well, based off your brain mapping. So when you come in for neurofeedback, and your treatment plans during the neurofeedback will be specifically exactly for you and exactly for whatever kind of neurological issues that you may be having.
So the important thing to know about this is that there's no electrical component here, right? This is EEG technology. So if you've had an EEG, if you've had a sleep study, this is that level of technology that we're using. And then the neurofeedback component itself is rewarding the brain, so kind of like training the dogs.
Right, exactly. So there's no current at all. We're not sending any kind of electrical stimulation or anything into your head whatsoever. The EEG itself is purely observing your brain. And when your brain is doing what we want it to do, we give it a little treat, which in our case is music. So it's like you were just saying, it's like training your dog. Your dog goes outside to use the bathroom. It comes in, you give it a treat.
Yeah.
Exactly. So over time, your dog learns that it should go outside to use the bathroom because it gets a treat. We're doing essentially the exact same thing with your brain. When your brain does what we want it to do, what we consider good, you'll get a treat. And the treat in our case will be music. Music/video, depending on what you're here for. So most of the time it'll be music. So every time your brain hears that music, it's basically saying, good job, keep it up. So over time, your brain learns to act that way on a normal, regular basis, even without us interfering. So it's a long-term, long-lasting effect. We don't need to be on medication forever.
So it's operant conditioning, kind of like Pavlov's dogs,
exactly.
Right? So it is ongoing, long-term change in the way that the brain is communicating and operating, right? So we have those certain set of sessions where we're training the brain to a more optimal functioning. And then at the end of that process, we do another brain map.
Right, exactly. So one of the great things about this is it's long-lasting, and the improvements are shown to work after the treatment's over. So when you first come in, we'll do a brain map. Then we'll have, on average, about 15 sessions of neurofeedback. Then we'll do another brain map at the end. And that way we can actually do a direct comparison, and we can see what improvements that you have, your neurological improvements and your symptom-based improvements, and to see exactly what's going on, what got fixed, and if we need to do anything different, or if everything's looking pretty good. If your neurological symptoms have resided a bit, then we can check it out and have a direct comparison.
And that's the cool thing about this. I've done neurofeedback with someone before, and they had some improvement of symptoms, but when we saw that pre and post brain map, there was just such relief for that person because they said, I knew I was feeling better. I knew that the symptoms were feeling better, but now I can actually see how differently now my brain is looking and how it's differently communicating with itself. So it's a real tangible thing. It's really a way of therapy for the future. And again, a nice holistic option for things like anxiety, depression, trauma, right?
Any kind of brain injury.
If you've had concussion, if you have had a mild to moderate traumatic brain injury, if you had a stroke, this is a nice option as far as helping you reduce symptoms, helping the brain to operate more effectively, communicate more effectively with itself. Yeah.
So neurofeedback has a wide variety of options. If you think you're interested in it, go ahead and check it out. You can give us a call. We'll let you know. I've worked in my past job. I've worked with many different neurofeedback cases in all different kinds of realms, all the way from autism all the way up to certain forms of dementia. So there's lots of different opportunities for neurofeedback. So if you might be interested, give us a call and we can let you know how soon we can help.
Awesome. So hope you guys are having a great day. Thanks for watching us, and we hope to talk to you soon. Give us a call, 813-434-3639. You can find out more about our neurofeedback services and more about Ben on the website, harpertherapy.com. You all give him a warm welcome. Good to have you with us.
Thanks.
All right, have a good day.
Bye, Ben.